There is a massive crave on the new weight loss drug Mounjaro, so much so that there is a shortage nationwide in pharmacies. Never underestimate the laziness of people who want to lose weight. But honestly, I don't blame them. It's quick, it's easy, it's a once-a-week injection, and it's very, very effective in weight loss. Let's look into the studies and see how effective it really is. Okay, so right before we get into Mounjaro, I want to kind of go over the other treatment options for weight loss currently on the market. So the first one is orlistat, which is available over the counter and prescription at a higher dose. This one is not very effective, but it is a decent over-the-counter option that you can buy at like a CVS or Rite Aid without a prescription. It has about a 5% efficacy in weight loss over a 6 months to a year period, but again, not very effective. The next one is phentermine. Now, this one is also not that effective. It's 5% and it has stimulant properties, which means that it gets your heart racing and keep you up, but it suppresses the appetite. But again, only a 5% reduction in weight loss. There's a combination of phentermine, which comes with topiramate, which is called Qsymia, has a little bit better efficacy. It's about 8%, but since it's a combination medication, you get all the side effects of phentermine plus all the side effects of topiramate. So a lot of people don't like this choice either. The next one is the brand name Contrave, which is also a combination medication of the antidepressant bupropion and the substance abuse medication naltrexone. Together, the brand name is called Contrave, and again, only around a 5% weight loss reduction. The next two medications are a little bit more effective than the ones I just mentioned. They are GLP-1 agonists, which stands for glucagon-like peptide, and it works on those receptors. Saxenda has around an 8 to 10% reduction in weight loss, and Wegovy has around a 15% reduction in weight loss, which is a huge jump from all the other ones. Now, these two medications, Saxenda and Wegovy, are actually used for type 2 diabetes under a different brand name. Liraglutide is known as the active ingredient. Victoza is the brand name for type 2 diabetes, and Saxenda is the brand name for weight loss. And then the other one's active ingredient is semaglutide, and its brand name for type 2 diabetes is Ozempic, and its brand name for weight loss is Wegovy. They're sold under two different brand names at two different doses for two different indications. Now, the new kid on the block is tirzepatide, and it's sold under the brand name Mounjaro. Mounjaro works similarly to Ozempic and Saxenda, and that is a GLP-1 agonist, but it's also a GIP agonist, which stands for glucose-dependent insulinotropic peptide. These effects of GLP-1 and GIP are synergistic, so they kind of help each other boost their effects. Now, currently, Mounjaro is only FDA approved for type 2 diabetes, but I'm pretty much 100% sure that it will be FDA approved for obesity and weight loss very, very soon. Now, let's go over the study and see how well it works. All right, so here's the study here. It's called the SURMOUNT study, and it compared tirzepatide versus placebo. Now, tirzepatide was divided into three groups: 5 milligrams, 10 milligrams, and 15 milligrams. So that means 4 groups total: 5, 10, 15, and then the placebo group. The placebo group lost only about 3% body fat. The average weight loss of the 5 milligram group of tirzepatide was 15%, 19% for the 10 milligram group, and 21% for the 15 milligram group. So weight loss was dose dependent. The higher the dose, the better the weight loss. However, that also leads to higher side effects. The higher the dose, the worse the side effects. That's why it's important to titrate with Mounjaro, meaning you start at a lower dose and then you increase it every 2 weeks or every month, however much your body can tolerate it, because it has very heavy gastrointestinal side effects if you take too high of a dose too quickly. And I'm going to go over some of the side effects here from the study. So we see here that the common side effects of Mounjaro were all pretty much stomach related: nausea, diarrhea, constipation, vomiting, heartburn, upset stomach, things like that. And as you can see, as we increase the dose of 5, 10, 15 milligrams of tirzepatide, we see higher and higher rates of these side effects occurring in the patient population. So just like the rate of weight loss, the rate of side effects was also dose dependent. Now, this medication is also very, very effective for type 2 diabetes and reducing cardiovascular risk, but I'm not going to really go into that because that's not the purpose of this video. We kind of just really want to look into the weight loss effects, but it is approved for diabetes and it's very, very effective. Now, Mounjaro comes as a once-a-week injection and the needle is pre-filled, so you don't have to do any kind of measuring yourself, so you won't get confused or overdose or underdose or anything like that. So that's what makes it really, really good. So you can self-inject your prescribed dose underneath the skin, or you can go to your provider's office once a week and have the nurse inject it for you. But it definitely is easy enough for you to inject yourself. Now, although this is a huge breakthrough in weight loss treatments, there are some barriers, cost being a huge one. Most people will not be comfortable with paying $1,000 out of pocket per month for this medication if their insurance does not cover it. That is currently the price for this medication, sold under the brand name Mounjaro, because the generic is not available as it's still under patent. And the other barrier is obviously side effects, as I mentioned before, all those gastrointestinal side effects. So if you're able to tolerate those and to be able to stomach the potential that you have to spend $1,000 per month, then this is a very, very effective treatment for obesity.